Okay. Tell us your name and spell it for us, and then give us a little bit of an understanding of your background.
My name is James McEwen, last name spelled M-C-E-W-E-N. I'm a PhD clinical psychologist who's been working in the field of rehabilitation since 1989.
Where did you get your training, and what sorts of environments have you worked in since then?
I originally started working in rehab and brain injury in the post-acute arena for a company out of the Northeast called New Medico. They had post-acute brain injury facilities all over the country. I started there as a staff psychologist and worked through the ranks to administrative roles, where I felt I could probably have a little more impact on controlling not only finances, but making sure we got the right patients in.
How long have you been at Lakeland, and what's your current responsibility?
I've been at Lakeland Rehabilitation Center for about, excuse me, I need to start that over. I've been at Lakeland Regional Hospital for about 2 weeks now. I am the director of the Inpatient Rehabilitation Unit and System Development. That's an administrative and clinical role that basically will assist in the development of the unit, construction of the unit, creating post-acute services after discharge, and working with the administrative and leadership team to make sure that we create a state-of-the-art rehabilitation unit, creating with the latest technologies that's evidence-based and using some of the most innovative approaches around to promote the highest level of functioning for our patients.
Something in the interview process must have brought you here. What is it that you saw about Lakeland that you said, you know, I got to be a part of this?
Well, I had the privilege of meeting the CEO, who's passionate about rehab and wanted to make this happen. I was working at a competing facility actually in the area. She toured that facility. With her background, it was obvious that she was going to be a champion for making rehab services happen.
And given the fact you came from a competing institution, I'm curious, what was Lakeland Medical Center's reputation out there in the rest of the world?
Very good. In fact,
Yeah.
Lakeland's reputation for medical care was very good. It was high quality with nationally recognized programs. In addition, we also got about 40% of our admissions to our unit from Lakeland because they did not have an inpatient rehabilitation unit. So the need was there. And the patients that didn't come to us, some went to lower levels of care, skilled nursing facilities, which didn't serve their best interests.
You come with an interesting perspective as a clinical psychologist to the field of rehabilitation. What do you think, what gap is going to be filled at Lakeland relative to patients and their families if a rehab hospital were built here?
Well, certainly.
Okay.
Can you repeat that?
Can I repeat it? That's always my challenge to remember it. You have an interesting perspective as a clinical psychologist coming to the rehabilitation field, especially at brain injury. What do you think the benefit is going to be to the patients and the families of this community if a rehab hospital is built here?
Rehab, for the most part, is a backyard entity. And right now, patients are having to leave the Lakeland area in order to get services and treatment elsewhere because there's not an inpatient rehab unit here in Lakeland. I think since most of the population is a Medicare population, individuals won't have to drive long distances in order to be able to get services that they truly need. And they won't, and some people don't go to inpatient rehab units because of the distance and are usually forced to take a lower level of care that's provided in a skilled nursing facility when they could benefit from more intensive rehab.
Good.
If you look at the overall scope of healthcare, rehabilitation care, here and elsewhere, What keeps you up at night? What are the obstacles that you go, oh, we just got to figure out how to fix this?
Well, the challenges are now, as an aging boomer, I want to make sure that services are there when we need them. And this is an exciting time here at Lakeland. We have an opportunity, as I said earlier, to create a state-of-the-art 32-bed comprehensive medical rehabilitation unit using the latest technologies, evidence-based practice, and innovative approaches to promote the highest level of independence possible for individuals in this community. That's exciting. I've also had the experience of working on the compliance side. In fact, I've been writing responses to the RACs, which are the recovery auditor contractors that have been hired by CMS to recoup funds. So it's given me additional information and knowledge of how to position a rehabilitation unit in the best way possible, knowing that the government is looking to take monies back after services have been provided.
How has what have you learned from your involvement with the American Board of Disability Analysts? How has that been? Okay.
Structured in his class.
You're doing great.
Yeah.
Oh, God, it feels...
Good speaking voice too.
Oh, thank you.
You want me to say that again? or-
Could you please?
Yeah. Are you guys ready?
Yeah.
How has your work with the American Board of Disability Analysts influenced your view of what needs to happen here with a acute rehab center?
It's kept me keenly aware.
Say it again. Yeah, sorry.
Ooh, that's
I'm
going
not
to
even sure I have it.
Can we try that one more?
Yeah. How has your work from the American Board of Disabilities Analysts influenced your thinking about a rehab center?
My work with ABDA, which is the American Board of Disability Analysts, has really increased my overall awareness and advocacy. It's a broad range group that basically is advocacy based, and believes in providing access to care. So that has really broadened my overall view.
What 3 or 4 aspects of delivering rehabilitation are absolutely critical to having a good patient outcome?
Wow. Top 3. 1, caring individuals.
You can set that up with,
Oh,
What, yeah, let me say it again. And
All right.
Yeah,
yeah.
yeah, 'cause I want to do what you have to say, that's good. What 3 or 4 aspects of service delivery are critical for good individual patient outcomes? Without it, it just doesn't happen.
several aspects that are key to good service delivery and excellent outcomes are making sure the individuals providing the care are caring, competent, and engaged. Second, we have to be able to document what we do with regards to the care that we give. That's also crucial. And third would probably be making sure that we can not only provide the service, but educate the patient and their families on what they need to do after they leave us. So we need to be teachers as well, so that the benefits that are gained in our setting carry over once they leave.
Think about a patient that you might know from someplace in your past. Describe what an excellent outcome looks like for a particular person. Everything aligned really well. What were the aspects?
That's one of the benefits of being in rehab, is that we get to see people grow. One of the most inspiring things is seeing patients come in, multiple trauma, stroke, whatever condition, non-functional, and through the process of rehab, the interdisciplinary team, medical management, family education, psychological services, watch them progress to the point that they either have come in on a stretcher and they walk out. That's inspiring, and every day there's a miracle that happens in rehab.
Amen to that.
Can we just cut a second? I'm gonna change batteries here, so we're not having to do another take. You go ahead. Okay, camera's rolling.
Describe some of your vision for what the rehab center would look like, particularly related to services and equipment that you might be looking to purchase.
That's an exciting question. Some of the state-of-the-art things that we really want to do, some of the things that could really separate us from service delivery in the area and really provide a significant impact on this community and the population that Lakeland Regional serves, since Lakeland Regional has a primary stroke unit, a trauma center, trauma surgeons. Now we have 3 neurosurgeons. The work that we could do with stroke, brain injury, spinal cord injury patients, multi-trauma patients could be tremendous in this area. Some of the equipment that I'm looking at, which goes along with the lines of being a state-of-the-art facility and not just doing what some of the other rehab centers are doing in the area, things that would really separate us would be making sure that we could get some of the latest technologies, and by that I mean either electrical stimulation equipment of a high-tech nature, primarily geared towards stroke, brain injury, spinal cord injury patients, or some of the robotics equipment. In fact, there's a robotic treadmill made by a company called Homica, called the Locomat, which right now is only used in about 30 facilities nationwide. It's basically a robotics treadmill where patients are put in a harness and they learn how to emulate with the assistance of robotics technology. I think that would be a wonderful asset for this area, as well as the population of Lakeland Regional, since we do have so many stroke, brain injury, and spinal cord injury patients that come through there. And it would immediately separate us from the rest of the service area and provide a huge service to this community.
Fundraising is obviously going to be critical for what you're talking about here. And also, current evidence suggests more time per day, more intense therapy is better.
Yes.
What would you say to donors? What are they going to get for their buck if they contribute towards the equipment or the services provided at the rehab hospital?
Well, they're going to get what the
Sorry, I made too long a question. What would you say to donors that are considering funding expensive equipment and treatment that isn't covered by insurance?
What's the return on their investment? Are the people going to be able, are these their employees, their employees' families? Are they going to come back to the community and be able to give back to the community by being healthy and happy again? What is the return on the investment, and why do we need that? Isn't there other facilities they can go to?
Okay, let me process that a second. Okay, and if we can condense the question to maybe two or three sentences.
Why should they give money?
Why should donors invest in this? Why should donors invest in all aspects of
Gotcha.
a rehab hospital?
Okay. I think donors should invest in rehabilitation because it's truly an investment in the community on so many levels, from the standpoint of not being, to being productive members of society, to getting back to work, because one of the areas that we truly want to look at is not only what happens on the inpatient side, but we want to make sure that we can carry those over to outpatient therapy. Part of what my role is going to be to work with some managed care companies as well to make sure that we can get workers' comp cases in and work with those people to get them back to work and get them off the workers' comp rolls. Aside from that aspect, returning individuals back to the community and into their normal lives is, I think that's what we all truly want.
As a clinical psychologist, you're particularly well positioned to comment on things related to the family unit. What sort of services would you like to see provided for family loved ones?
Family education, providing services to not only the patient but to the family is key in making sure that the gains made while they're in rehab hold. That's where they're going to return. They're going to return back to their loved ones who will be providing some of the burden of extended care during the sometimes prolonged recuperation period. So making sure that there's a psychologist, a social worker, family training, all of the available resources, especially with certain patient populations like spinal cord injury, which will require quite a bit of psychological and social services in order to make sure that they can deal with the emotional aspects of their injury. So we want to make sure that we build in all of the necessary components to treat the whole person, not just their physical disability, but also deal with the emotional aspects of the trauma and the ongoing disappointing aspects of not being totally functional.
Just wanted to phrase this. If you're talking to a family member who's wondering, why should my loved one go to Lakeland? What questions do you think they should ask and hear answers to?
When families are making a choice about what level of care they need for their loved one, they need to ask, do I want them back home or do I want them institutionalized? That's truly the ultimate question. There are different levels of service and they all have their place. Inpatient rehabilitation units provide the most intensive level of rehab to promote the highest level of functioning possible. If that's the goal of family members, to get their loved one back home, then that's the choice that they should make. They should ask about the number of individual hours of therapy per day. They should ask about nursing hours per day. They should ask about how things are medically managed if an emergent medical situation comes up. That's the beauty of an inpatient rehabilitation unit located within a hospital. If emergent issues come up, you're within a hospital setting. They can be dealt with quickly, thoroughly, and in as comprehensive a fashion as possible to get the medical issues settled so then the patient can get back to their rehabilitation. It's key to choose the right setting early, because starting off in a less intensive setting can really be a setback. And with the way funding is now for most rehabilitation services, you only get one shot. So making the best choice first is key to recovery.
Talk a little bit about the benefits of continuity of care, especially in light of comorbidities.
That's the beauty of having an inpatient rehabilitation unit and outpatient services provided in the same area. One of the things that we will be looking to do at Lakeland is to make sure that there's a seamless connection between inpatient and outpatient. Upon discharge, patients that are appropriate for our outpatient services, we want to be able to immediately connect them to outpatient. And the beauty of all being on the same team within the same hospital, we can invite the therapist that may be treating those patients to the interdisciplinary team meetings within the hospital during the inpatient stay. So they'll have current knowledge of what the patient's needs are, what the current treatments are, so that can be carried over to outpatient and make the most functional recovery possible.
If you could talk to therapists that are considering relocating in Lakeland, how would you convince them to come here? What would you say?
The first thing I would say to them, if I was looking to recruit therapists to this area, which will be a challenge, it is difficult finding therapists, and to find enough therapists for a 32-bed unit will be an ongoing challenge. However, We are positioned with a CEO, rehabilitation champion, who's a physical therapist. I will definitely engage our CEO in our recruitment efforts, being able to provide high-tech, evidence-based, best practice therapies will be appealing to newer graduates who I think would be very well suited for this endeavor because they'll be interested in something that is technologically based, which will be one of the foundations of providing our state-of-the-art service. And the growth potential in this area for a new unit. New is always highest and best use. Everyone wants to be associated with something new. And I think with the marketing and the packaging that we can do with regards to the built-in neuro, stroke, and multi-trauma population that we have, that'll be attractive for not only new therapists, but therapists that are already in the area that may be looking to grow their careers and their skill sets. So that's going to be an exciting aspect of building this program, getting that message out to therapists.
Talk about your vision for academic partnerships.
Working with, well, no. Okay. Okay.
Talk about your vision for academic partnerships in the rehab center.
One of the things we can do to help recruit therapists is to make sure that we have affiliations with various allied health schools. I do know there are various affiliations now that Lakeland Regional Health System's looking to incorporate, but there are also, as I said, allied health schools. There are PT schools, there are occupational therapy schools. So naturally, over the course of time, once we get seasoned therapists on board, we will build relationships with those schools for student placements, which then can be an ongoing feeder source for therapists and growing our services. Because the number of therapists that would be required to open 30 to 32 beds from the start would be somewhere in the neighborhood of 30 or 40. And there aren't that many right out of the gate. So it will be a staged plan to make sure that we can not only hire the correct number of therapists, but therapists with the right kind of training and mindset for the mission that we're going to undertake.
In a sentence, why should Lakeland build a rehab hospital?
Because Lakeland should build a rehab hospital because there's a tremendous need in the area. This hospital has been sending a tremendous number of patients outside of their home area for programs and services that if the unit had been here, they could have been treated in their own community, which is truly what most people want. If I can get treatment at home, why should I travel outside of home? And Lakeland is the 4th largest hospital in the state, 4th or 5th largest hospital in the state.
Can you start that again?
Okay.
The 5th largest.
5th, thank you. Lakeland is the 5th largest hospital in the state of Florida, and it's a level 2 trauma center. It needs its own inpatient rehabilitation unit, and the flow of patients through the hospital alone would be enough to support it. And since it is going to be a lightning rod for technology and it's a new unit, it will be a regional powerhouse with regards to provision of services.
Excellent.
Let's talk about the emotional aspect we talk about the patient all the time, but let's.
Just
Yeah.
a sec.
How will having an in-house inpatient rehab center benefit families?
Or will it?
Just a sec. The families of patients will benefit from Lakeland Regional having its own rehab unit in a variety of ways. One, as I'd mentioned earlier, they won't have to drive extreme distances to get their loved one placed at an inpatient rehabilitation facility. Polk County is a rather large county. There's one other inpatient rehabilitation facility in Polk County. Other than that, families would either have to drive to Orlando or Tampa. Since a large part of the rehab population is a Medicare population, driving distances at night is treacherous. The roads are dark and known for curves, given the fact that there's so many lakes in the area. That is dangerous, it's tiring, it's an emotional drain on families. Being able to visit your loved one in your community is a huge benefit to the elderly population, which is a large part of the population that we serve. That is less trauma. And then also, after discharge, being able to provide outpatient services in your own hometown would be an additional benefit. So families will not only benefit from the comprehensive nature of services that will be provided at the unit, but the convenience of having it in their own hometown.
Typically in rehab, there's family members think, I'm kind of in this alone. There's this sense of being isolated in the environment and in the situation. Can you describe any experience you've had in your other you would implement here?
One of the mechanisms that families can really benefit from are support groups for either stroke, brain injury, spinal cord injury. Lakeland Regional currently already has a stroke support group. Once our brain injury services come on board, we will probably do the same thing with a brain injury support group. Usually these support groups meet monthly and provide peer and family support for people that are going through similar issues. They can then brainstorm on how they're dealing with it, talk about their experiences, and provide support for each other. And usually it's guided by either a therapist or someone with a rehabilitation or allied health background. So that'll be a key component for aftercare from either inpatient or outpatient. The ongoing support provided by other families and individuals that are in similar situations. Please tell me we're almost done.
Yes, you're doing great.
I think I have one other pet peeve question for you.
Sure.
Tell us why you left the interview.
Oh.
Hold on a second. Okay. You have a pet peeve question?
I have a pet peeve question. In the olden days, back when I was back in the mid-'80s, we always sent patients home for a home visit before they went home and got all the adaptations, and that's fallen away from a reimbursement standpoint. So if home visits are important and you're gonna have to find funding, what would you talk to donors about in terms of the importance of a home visit prior to discharge?
Once patients go home, and in preparation to go home, that's tough.
I know.
That's
That's
tough.
called a pet peeve question.
Yeah.
So that's not covered, Karen?
I
No.
don't know if it is covered. I've been out of the
No.
rehab for a long time. I don't
Yeah, we
think so.
can't, we need to be careful with that too, because that's different with state of Florida.
Well, not the covering thing, but
Yeah.
just the, I think it's an absolutely critical.
Well,
component.
you're
gonna have good
you're absolutely
continuity
correct.
care, you gotta have
Well,
that link.
Definitely.
but we used to send therapists to the home
Yeah,
so
and we used to do it all the
that
time.
they could see what the layout was,
Yeah.
figure out how to make the home more suited for the patient. Yeah, but no one pays for that
Well,
anymore.
take the funding part out, I guess maybe just from an educational standpoint,
Yeah.
in terms of somebody watching the video.
Sure,
What is the,
sure.
why do you think it's necessary for a home visit to be done before somebody is actually discharged? How does that benefit the patient? How does that benefit the family?
One of the ways we can benefit the patient in preparation to go home with their families is through ongoing patient education. One of the things that we've done at most of the facilities where I've worked has been a fall prevention education program. Once individuals that have had strokes go home, they need to know some of the things not to do in order to keep from falling and re-injuring themselves, getting an additional head injury, or if they had an orthopedic issue, making sure that they don't get another fracture. So ongoing education about how the home needs to be set up, what needs to be close, what needs to be removed. Things like rugs can be extremely dangerous and are a trip hazard. For individuals that are either using walkers or canes or have some sort of mobility deficit as a result of a stroke. So the ongoing education about how the home is set up, how you need to remove certain things, how you may need to adapt your bathroom with grab bars, all sorts of adaptive equipment is talked about and discussed prior to discharge. That's the best I can do with that.
Don't we though, within the context of this, want to bring up shortcomings and talk about them and how Lakeland would address that? I mean, to say that there seems to be a real shortcoming with home visits in preparation before they're sent home, and we want to incorporate that. And in talking with Elaine, she was saying that that would be things that would be funded.
Yeah.
Because it's not covered, so
Mhm.
she would seek funding.
But we need to be careful about what we promise because this is ever evolving. So we know what the first phase is going to be, and, you know, perhaps, but it's all on legislation and funding, so we have to be careful because this is footage we won't even be able to use. We don't want to waste, you know, that would, I mean,
Sure.
that's our hope and dream, but in reality, what's going to be able to be funded and what's going to be able to be approved, maybe two
Sure.
different things.
I mean, do we need to just get it in the can in case it is something that maybe?
Well, let's talk about some of the hopes and dreams. I think he talked about,
Well-
he incorporated that with his equipment.
Well, let me talk about maybe other home type services than like home health.
Some other community land, I guess that's.
Sure.
Okay, yeah, I don't want to dominate areas that I'm doing.
Well, no, that you bring up an excellent point, but
Yeah.
I can't speak about what I don't know. I would prefer not doing that this early in my tenure.
You want to stay a third week, huh?
I just think how much it'd be easier it would be to let you go, you only been here 2 weeks. That's teasing.
Oh,
Oh.
guy, I'm so sorry.
So what's the
Oh.
question we're asking?
Well, it would be,
In a perfect world,
Okay, go ahead, phrase it, go ahead.
in a perfect world, what would you want to see Lakeland Regional's rehab center be able to offer that's out of the box?
the perfect situation for families upon discharge would be a situation where prior to discharge, therapists could actually go to the home and evaluate the home where the patient's going to be spending, well, where the ex-patient then would be spending most of their time on discharge. They could assess the bathroom, they could assess the bedroom, they could check for things that might be tripping hazards, any other home modifications that might be needed. That would be extremely useful. I think the closest thing we have to that now for patients that either don't want or can't get to outpatient services are home health services, where those agencies go into the home either on a weekly basis or 2 or 3 time a week basis to make sure that things are set up okay and the family's functioning well post-discharge.
Yeah, that was a beautiful way to handle it.